Good morning, everybody. My name's Nadia Higson and I'm the Vice Chair of Trustees for the charity AIMS. I'd like to thank the conference organisers very much for the opportunity to talk to you today and to explain a little bit about what AIMS has been doing to try and support individual choice in the extraordinary circumstances of the coronavirus pandemic. Now, some of you may already be very familiar with AIMS, some of you may not have heard of us. So I'd like to start by just explaining a little bit about who we are and what we do, and then I'll go on to talk more specifically about what we've been doing over the last few months. So AIMS stands for Association for Improvements in the Maternity Services, and we've been around for a long time. We're 60 years old this year. We had been planning to hold a workshop for birth activists and a celebratory birthday dinner back in June. Unfortunately, for obvious reasons, that wasn't possible, but we're still hoping to hold the same event next summer, and it would be lovely to see some of you there. In terms of what we stand for, in terms of our mission, there are really two sides to this. The first side is supporting individual maternity service users to navigate the system to get the care that they want and need. The other side is campaigning to try and improve the system, as our name says, to create a system that truly meets the needs of all. And when we say all, we are thinking primarily of all maternity service users, whatever their background, whatever their individual characteristics and needs. But we're also thinking about their partners, their families, their midwives, their doctors, their doulas, their antenatal educators, all the people who are supporting them, and something that meets the needs of society as a whole. So how do we do that? Thinking first about the first part of that mission statement, the support that we offer. We offer individual one-to-one support to maternity service users who contact our helpline, either by email or by phone. We have a very knowledgeable and enthusiastic group of volunteers who man that helpline. They're all lay people, they're not medically qualified, and we don't attempt to offer medical advice, but they are doulas, breastfeeding counsellors, antenatal teachers, all people who are very well informed about matters to do with birth and all associated subjects, and experienced in supporting individuals. So that's one very big part and very important part of the work we do. We will always on the helpline try to make sure that we are giving people evidence-based information, and this is actually a very important theme that runs through all of AIMS' work, that we give information that is research-based where the research exists, that is objective, and that enables people to make their own decisions. We recently came up with a phrase that we want to open doors for people but not push them through them. So other ways in which we provide that information, firstly on our website, we have an increasing number of birth information web pages which are being written again by knowledgeable and experienced authors, some midwives, some lay people. They cover a whole range of subjects, but many of them are subjects which are frequently coming up on the helpline, which mean that our helpline volunteers can direct people towards those. We also publish the AIMS Journal. This is published 4 times a year. It's now an online journal with open access. So please, if you haven't ever looked at the AIMS Journal, do go take a look at it. Do have a read through. There's a whole range of different articles on there, covering many different subjects. You can read them, you can download them, you can share PDFs or links with your colleagues or with your networks. I hope you'll find it a really useful resource. And we also have our AIMS publications. Over many years, AIMS has been publishing books. We've now got our new AIMS Guide 2 series, of which the first 2 titles have now been published and are now available in our online shop. They're also available as e-books. for anybody who prefers that format. First one was the AIMS Guide to Resolution After Birth, and that is intended to help anybody who has had any kind of distressing experience during their maternity care or afterwards, to help them find whatever kind of resolution is going to be best for them. We also have the AIMS Guide to Induction of Labour. Again, this is very much focused on the individual maternity service user. It's for people who may be needing to make a decision about whether to have their labour induced, to provide them with the research evidence and questions to ask and things to think about to help them reach the decision that's right for them. Or for people who have made the decision to have their labour induced, who want to know how to prepare for it and how to make it the best experience possible. So the main audience is the individual maternity service user. We hope that these will also be useful handbooks for anybody who supports them. And there will be many more titles to come. Some are already in production, others are in the planning stage, so do look out for those. Turning to the second half of our mission statement and the campaigning side, I'm not going to read all of these out, but as you can see, we carry out our campaigning in a variety of different ways. It's mainly at the national level, although we do also try and support local birth activists, providing them with tools and with information to support them in their local campaigning as well. So that's AIMS on a day-to-day basis. Earlier this year, coronavirus arrived on our shores and we needed to react to that. The first thing that happened was a massive increase in the calls that we were receiving on the helpline. And we identified a number of themes that were starting to emerge time and time again. One of these was that although many trusts were maintaining their home birth services and finding very creative ways to do so, others were just putting in place a complete blanket removal of support for any home births. And some of the calls we received as a result from people who had been planning home births and were suddenly told support was not going to be provided for those was really heartrending. We were hearing from people who were still suffering psychological trauma from the way their care in previous births had been mishandled in hospital, who simply could not face the prospect of going to hospital to give birth again. We were hearing from people who were desperately worried about the risk of infection if they were leaving home, having to go to hospital to give birth. We were hearing from people who would not have any support from a birth partner if they were to give birth in hospital, because their own partners would be needing to provide childcare for their older children. And as a result of all of that, we started hearing a lot of people who were asking about the option of free birth, of having a home birth without any midwifery support, because that support was not going to be forthcoming. At the same time, a number of trusts were also closing their birth centres, so in some parts of the country there was going to be no option for people but to give birth in hospital or to give birth unattended. Another issue which came up very frequently was the fact that supporters were not being allowed to accompany people to their antenatal appointments, or in particular to ultrasound scans. And that was obviously a very big issue for some people, because somebody who had suffered previously a pregnancy loss, or who had had to make a decision about whether to terminate a pregnancy if their baby had a severe disability, were now being expected to go to those scans and possibly face hearing bad news again with nobody there to support them. A third issue was the more general restriction on birth supporters being present throughout labour and birth. In some cases, trusts were saying no birth supporters at all. Sometimes they were saying only one birth supporter. Sometimes they were saying birth supporters only from when that mother or birthing person is in active labour. And this again was causing serious issues for people. And what we felt this was demonstrating was a lack of consideration for individual needs, for people with mental health or emotional needs, for single mothers who might not have somebody from their own household to accompany them, but were being told that their birth partner had to be somebody from their household. As I've said, people who could not have somebody else to accompany them if their own partner was having to look after their children. So we felt there was a very big concern there that individual needs were being swept aside and not given due consideration. Another issue was the lack of transparency and the lack of information about available birth choices. And many trusts were not putting information on their websites, were maybe putting it on a Facebook page, which not everybody has access to in the first place, and certainly it's not easy always to find information on there. And sometimes we were finding that even midwives didn't actually know what the local policy was or what choices were available. And finally, we were finding a lack of transparency around the planned service changes, why those services had been put into place, whether there were plans to restore services at a certain point. It was proving extremely difficult for people to find any information about that. So those were the issues we were discovering. What did we try and do about that? Well, the first thing we did was to put together a new birth information page. This one, Coronavirus and Your Maternity Care. What we're trying to do here is to summarise for people all of the guidance that has come out from the NHS, that's come out from the Royal Colleges or from elsewhere. Try to explain the research that's based on, or in some cases the lack of research that is based on, and trying to interpret for people what that should mean in terms of the care that their trusts really should be offering them. We're keeping that page up to date, by the way, so every time new guidance is coming out we are revising it, and hopefully it will always have the latest information on it. We also created an information page about free birth, because we felt that if this was an option that people were considering, they really needed to have information, they really needed to know where to go for support, so that they could actually make an informed decision as to whether that was the right thing for them and for their babies. So we hope that those are proving useful. We've had a very large number of hits on both of those pages since they went up. Please, again, do share them with anybody who might find those useful. The other thing we did was to create a set of template letters which individuals would be able to send to their NHS trust or their board to try and get their own needs met. So AIMS has for a long time had a template letter which aims to help people request the support they need for a home birth. So we actually produced a new one which was going to be for the specific situation about trying to get support for a home birth in areas where trusts had withdrawn support. We also put together a set of letters for people to ask to get their support needs met in situations where trusts were restricting birth partners, banning all birth partners, or limiting to certain circumstances. What we also put there were some suggestions for people that anybody sending those letters might like to copy in. So we suggested they copy the AIMS helpline so that we would know what was going on, and so that the people they were writing to, heads or directors of midwifery, and we also suggested they copied trust chief executives, would know that AIMS was involved and AIMS was actually seeing what was going on. We also suggested that people should copy them to senior staff in the NHS and to the relevant politicians in each of the 4 nations of the UK, again to just try and raise awareness of what some of the issues were and hopefully encourage people to step up to their responsibilities towards their service users. I'm pleased to say that we've seen some success with these. We don't always hear what the outcome is, but here are a couple of cases where we know these letters have been effective. I'll just let you read through this one, which was from an individual mother. So that was an example of a trust actually listening to an individual when they had actually written to express their needs. So that was very pleasing to see. Another example was where we had a group of activists working to try and improve things locally. Their local trust had stopped support for all home births and had stopped all water births. They contacted the AIMS helpline and said, is there anything we can do about this? So we said, well, actually, yes, we have this template letter. You might like to look at sending that. So they adapted that to their local situation, sent that to the Director of Midwifery, you can see there, on the 10th of May. 4 days later, the Trust announced that they were reviewing the policy, and a week after that, they announced that water births and home births were being reinstated across the Trust. So again, an example of what a concerned group of local people can achieve just by asking the questions, which is really what they were doing. So at the same time as all that individual support was going on, we were also trying to carry things forward at the national level on the campaigning front. We've put in a number of responses or queries to various things that have been published, to the guidance from NHS England to trusts, came out in April, to the guidance by the Royal Colleges, and also to the Health and Social Care Select Committee inquiry into NHS care during the pandemic. If you're interested in what our submissions were, you can go and find those on our campaigning page. But the sort of issues we were raising are very much what we were talking about. The fact that individual needs were not being taken into account, the lack of transparency in planning and in communicating information to people. Also about the human rights issues that we saw, because I know that Maria Brooker from Birthrights is going to talk more about this later on today. Very often we felt that the response that trusts were making to the pandemic was not proportionate and was not taking account of the needs of individuals in the way that they should. We were also very concerned that because many trusts were saying they would not admit birth partners until someone was in active labour, that people were being coerced into having a vaginal examination to prove that they were in active labour in order to get their birth partner or other supporter with them. And that was another serious concern, that human rights were being swept aside. And that is never right. We also put together another set of template letters. These ones were intended for birth activists. One was for people to send to their trusts to inquire what was happening about the midwife-led services, the home births and the birth centres, whether the trust had an escalation and de-escalation plan in the way that the RCM and RCOG guidance has suggested they should, how those plans were being developed, what the plans were for when services would be restored, and how people could actually find information on that. And another one which was for people to write to their MVP chairs, because the guidance from NHS England was very clear that MVPs should be involved in local decision making, in co-production of materials. Really just to ask the MVP chairs, is that happening for you? And are you being involved? And can we find that information? And finally, we were also posting on social media what we call our rapid responses, which are where we will just come out either to welcome something that we've seen that is good, or to query something that we feel is maybe not so good or needs further thought. So I hope you'll agree we have been doing quite a lot. We would really like to do more, and for that we need your help. So I'd just like to finish by running through some of the ways in which you can get involved with AIMS and with supporting our work. Firstly, you're very welcome to join our mailing list. This is for people who just want to follow what AIMS is up to. We send out a quarterly update, and from time to time we send other information about events or things that are going on. As I've said, we'd really love you to share our journal articles, our web pages, our social media posts with your colleagues, with your own social media networks, spread that information as wide as possible. Even better, I'd love you all to become members. AIMS doesn't accept any advertising, so membership fees are a really important part of our income stream. The more members we have, the more we're able to do. So please do think about joining us. Even better, please do think about becoming an AIMS volunteer. As I hope I demonstrated in the first part of my presentation, there are lots of different roles for volunteers. Some people give a regular commitment, other people just get involved from time to time on a particular task or a particular project, writing an AIMS response or helping to write a web page. There's opportunities for anyone, however much time they can give and whatever skills and experience they have. So please do get in touch. The other thing we're looking for now is to actually expand the trustee group. Because as I said at the start, we want to create a maternity system that meets the needs of all. At the moment, we're very conscious that our trustee group does not have a great degree of diversity to it, and that we really need to be able to hear the voices of all maternity service users from all different backgrounds, people of different ethnic heritage, people with different gender identities, people with disabilities, a full range of voices from across the UK. So if you or anybody you know might be interested in taking on that role, we would really love to hear from you. We have information on all of that on our website. Again, there's the link. The other thing I should say is, if you would like to make a donation to AIMS, we would really appreciate it. We're running a campaign at the moment of raise £60 for AIMS' 60th birthday, but if anybody wants to raise 600 or 6,000, we would certainly not have any objections to that. So thank you very much for listening. I hope you found that interesting. Please do get in touch with us if you'd like to know more about anything that I've talked about, or if you have any suggestions for what else you think AIMS should be doing. Thank you very much.